Hi, and welcome to Better Living for Better Health. I'm Jamie Smith, your cancer control specialist with the Kentucky Cancer Program. I'm happy to have with me today Dr. Lisa Lasher and Dawn Ramage, both from Lourdes Hospital, and we're going to talk briefly about breast cancer awareness, and some screening tools that will be useful for women in our community. Dr. Lasher, I'd like to start with you. Real quickly, I just want to go over some breast cancer statistics for the state of Kentucky. According to the American Cancer Society, in 2007, there will be 2,590 new cases diagnosed, and from those, there will be 600 deaths in the state of Kentucky. Now, some of those may sound kind of astonishing to some people, but actually those have gone down over the years, which is very promising. But in your practice, you'll probably be able to tell us better what you see, and then also as a breast cancer survivor, you're probably aware of some things in the community. You want to share some brief stories with us?
One exciting thing that we see more early cases of breast cancer, and those are the ones that are if we have to have breast cancer cases, we want to catch them early. And until we have a cure for breast cancer, our whole goal is early detection and early diagnosis. Patients tend to do very well with early stage breast cancer. Myself, I was a stage 1 breast cancer patient, and the long-term survival rate is very, very high, 99% at 5 years, and so those are the types that we want to pick up. So fortunately, with all the education and the promotion of mammograms and just all the awareness that patients are more educated, and they tend to do better as far as with their early detection and getting their mammograms, and that helps us to pick those up at a time where they're easier to treat.
And the different screenings that we talk about breast cancer would be the self-breast exams, the clinical breast exams, and then of course mammography, which Dawn's going to share a little bit more about that. But in your practice, what is your advice to patients whenever they come in about self-breast exams, and then maybe you can tell a little bit about clinical breast exams?
We still advise patients to do self-breast exams. Unfortunately, as women, we tend to do a lot of different things, and we're busy, and we tend to not always get to the doctor the way we should. So amazingly, more breast lumps are found by the patient than by the doctor. And if you think about it, you only see the doctor most of the time just once a year, and with the self-breast exams, and that we try to encourage patients to check their breasts the week after their period. And if they're not having periods, and just pick a time each month, and maybe it's the first day of the month or whatever that they can remember to do each month. And then that way they get in the habit of noticing if there's something different there. If there is, then they need to call their doctor and get it checked out. So I still really believe that self-breast exam is an important tool as far as with diagnosis of breast cancer. And remember that most lumps tend to be benign. So even if you find a lump, it doesn't necessarily mean it's a cancer. It just means that you need to get it checked out. Now, as far as with the clinical breast exam, it's a very good idea to always see your doctor once a year and have that breast check. And a lot of times as we get older, or after we've had our children, and say we've had our tubes tied, or for whatever reason, or had a hysterectomy, we tend to think we don't have to go to the doctor every year. And that's really not the case. Your breast cancer risk increases as you get older. So it's very important to see your doctor once a year and have your breast exam, and then also with the mammograms. But by just getting a mammogram or just doing self-breast exams, it's all not enough. You need to do every one of the 3 steps, and with that, then that helps us to pick up the breast cancer at an early stage.
Okay. Dawn, do you want to talk a little bit about mammography, and maybe talk about the difference between film and digital, which digital is becoming very popular now?
Digital is very popular. Just about everybody in Paducah has digital now. The difference in film screen and digital is that the digital mammography can be viewed on a computer. It can be enhanced by the computer. The radiologist can use a CAD program, which is computer-aided detection. It's just another set of eyes that helps them to pick things out of a dense breast or any breast. The digital mammography takes about half the time as film screen. There's less repeats. Patients don't have to be called back as often due to artifact or film jam, because it's all on the computer.
So what should a lady expect when they walk into your office to get a mammography done?
They should expect to be met and greeted. Don't wear deodorant, perfumes, lotions, anything like that before they get there. Fill out a history sheet.
For that?
Sometimes there's materials in the deodorants or the powder that can actually show up on the mammogram and look like calcifications, and it's just a false reading. So we ask that they not wear that. Fill out a history sheet maybe and give us just a little bit of their information, family history, personal history about themselves and their breast, and then take them back and the mammogram's actually performed. We do 4 pictures, 2 on each breast, and additional views if need be.
Now, some women might be a little bit nervous because they're very scared that it may be a little bit painful. Can you tell a little bit about digital mammography and how it's changed that process for women?
At our institution, we have a machine that is just virtually pain-free. It's awesome. Women love it. You still get compression, but with the paddle that we have, the way that it is shaped, and the compression that comes down, it stops when it touches your breast, and then we can gently compress the breast. They still get as much or more compression, but they don't realize it.
Okay. And we were talking just briefly a little bit before the show, and you were saying that you've been with you've been a tech now for 19 years.
19 years.
And you were talking too that you've also seen that not only does breast cancer occur in women, but also in men. But you said that rate's not as often, of course.
Right.
So,
Right.
What has been your experience over the years? Just the total transformation in technology? Is it just
It's been
amazing?
great, yes. When I first started out, we were doing Xerox mammography, which was blue ink or blue powder on paper. And then we did that for a couple of years, and then we went to film screen mammography. And then in 2004, we went to digital mammography. So from Xerox to digital, it's just huge.
It's been a major change.
Yes. We see a lot more breast cancers.
Well, that's great. That's great. And I think that probably has a lot to do with what you were talking about earlier, Dr. Lasher, with finding breast cancers early as new technology is formed, and that plays a major role in that.
I think also an advantage of digital mammography is for younger women when they have a mammography performed that the breasts are more dense in young women, so it's harder to read, and then it makes it more painful. They have to compress more. But with digital, and the journals have all supported this finding that in women less than 50, it's a better detection tool than the old film mammography, and a lot of that is because they're able to see into the breast easier. So that's a big advantage for digital mammography, especially in younger women, and that makes it less uncomfortable. So.
Now, I know that some people before may have been taught that they need to have a baseline mammography done at a certain age. What age do you all suggest doing the mammography to begin with? That's one question we see a lot is they call and they say, I need to have a mammogram done, but I don't know what age I should be. And it may be different for different women, of course, but if, maybe you could talk briefly about that when you would refer a patient for a mammogram.
Well, I definitely like patients to have them by age 35, and a lot of times where a lot of these ages that you hear when you should have it done, a lot of those are determined by insurance companies and when it's cost effective. In my case, I was 32 when I had breast cancer, so I still was too young for a mammogram, so you can't always go by the book, and that's why I always caution women, just because you're technically not old enough to have a mammogram doesn't mean you can't get breast cancer. So if you feel a suspicious lump, mammograms can be done at any age, but they're harder to read in younger women. So that misconception that you don't need a mammogram earlier, for no risk factors, then we wait till 35. But if you feel a lump, we can order them sooner. Digital's helped a lot with that. And then as far as there's a difference in screening and diagnostic mammograms. For screening, when patients have no symptoms, that's where a lot of this comes into play. But as far as when they're recommended, and you check with your insurance company as far as when they'll cover. But if you have a lump, most insurances are pretty good about covering, and they're more diagnostic. So if you haven't had a mammogram and you're over 35, you should have one. If you have a family history of breast cancer, a lot of times we'll start them even at age 30. But anytime there's a suspicious lump, that can be done sooner. And so some of those recommendations are based on more cost effectiveness on how many lives you save by doing mammograms at certain times. So it's not always, if you're that one, say like in my case it was 32, if I'd have waited till I was 40, I wouldn't be here now.
Right.
And so so that's the whole advantage of clinical breast exam, and then self breast exams, and then also making sure you get your mammograms on time.
Okay. All right. And so whenever a woman just goes to her doctor, then the doctor will talk to her about that and refer her to the proper location, whether it be at the Lewis Medical Pavilion or wherever. Okay. Well, whenever we come back from a break a few minutes, we're going to talk about MRIs. I know that that's a new and popular thing that we've seen lately in TV and news and media. And so I know that you've had some late news about MRIs that you'd be happy to share with us. So we'll cover that whenever we get back from our break. Hi, and welcome back. Before the break, we were beginning to talk about MRIs, and so Dr. Lasher, if you would just kind of share what an MRI is and why a patient would be referred for an MRI.
MRI is our new diagnostic tool that we have at Lourdes Hospital for breast detection, and basically the MRI is not for everyone. It's a extra test that's it's just like a lot of people have heard of an MRI is if they've had a headaches or they're looking to find out if they have a brain tumor or for a joint problem, but now they have a special coil that's put in the MRI to look at the breast, and it's an extra detection tool to determine breast cancers. Now at this point we're not doing MRIs for everyone. It's only in special situations. Basically you still start with your mammogram, and then if the mammogram is normal and there's still a lump, or the surgeon or their medical doctor feels it's necessary, then you go on to the MRI as the next step. Patients that the New England Journal of Medicine just came out with a recent study that screened 969 women, and they had breast cancer in one breast, and then they were screening the other breast to see if mammograms were good as far as the detection. This was even with digital mammography, which was our wonderful tool that's improved over the former mammographies. And they picked up 30 cancers on the opposite side by doing the breast MRI. So basically, where the MRI is to help lower the false negative rate that mammography can have. Now, the wonderful thing is we keep advancing and we keep improving our tools, but now we have something, so if a patient has breast cancer, those are patients that are a candidate for the MRI to look at the other breast. If a patient has had breast cancer and for future follow-up on that side, then an MRI can detect a lesion earlier that might be missed by mammography. Patient with a strong family history. There's the BRCA gene, which is a gene a specific cancer that families can carry. Say there's several first-degree relatives with breast or ovarian cancers, those patients might want to consider an MRI. Unfortunately, our technology is more advanced than the insurances, and so at this time we still struggle sometimes to get MRIs approved. So you want to have your MRI pre-certed before you go and get that. They cost around $1,500. They're more expensive than the mammography. But if you're that one person that picked it up, it's all worth it. So it's one of those things that you want to work through your physician as far as getting it covered and make sure a good candidate. Another thing that we see when patients have had implants and they have difficulty with getting mammography, now digital's made that much improved, but sometimes with implants it can still make it look like there's a suspicious area. The MRI is able to see through that a little bit easier. Or patients that have chest wall disease, say they've had a mastectomy and there's still some breast tissue that's hard to detect with mammography, the MRI is able to look on that chest wall. So it gives us another screening tool. It's not for everyone, but it is a wonderful addition to what we already have. And we're really excited at Lourdes Hospital in the Lourdes Women's Center that we have breast MRI, we have the digital mammography, we have stereotactic, all the latest technology that some patients travel several miles to get to, and we have it right here in Paducah. So we're very happy about that.
That's great. And how long have you all had the MRI now?
We've had MRI here for the breast for about a year. We just recently added the computer-aided detection for the breast MRI, and that's something that is very helpful. And I just want to go over with that the computer will pick up any suspicious areas. So it's wonderful for the radiologist. It gives them a second set to read, to fall back on. So we still have a radiologist that's reading them, but then you also have the computer that can point out areas that the radiologist needs to look at closely.
And Dawn, how long have we had the digital mammography now in Paducah?
We got digital mammography at Lourdes in October of 2004.
Okay, so it's been here for a couple of years now. And that's something too that you're talking about. It's so nice to have everything right here and not have to travel 2 or 3 hours away to get that more advanced technology. So we're really fortunate to have that in our area. One thing that we will talk about real briefly is maybe after a lump is found in a breast, what would be the next step for a patient? Where would they go?
Well, if you feel a lump and you want to contact your doctor first thing, if you feel that the lump is there, sometimes a patient needs to take charge and make sure that lump gets taken seriously, because unfortunately, especially in younger women, sometimes it gets because you're pregnant or because of that time of the month. You know, be consistent and persistent as far as with getting that diagnosed. Mammography is one step with the digital imaging. Ultrasound can be done. In patients that are pregnant, don't let the pregnancy keep you from having testing done. Ultrasounds can easily be performed while you're pregnant. And then the doctor then will refer you on for those tests. And then a lot of times in our office, we will refer on then to a breast surgeon. And it's not necessarily to mean that you're going to have surgery. That's a specialist in that area. Just like I'm an obstetrician, I specialize in pregnancy. We are a primary care provider for women, but as far as breast disease, we're good at screening, but as far as with treating that, I don't treat the breast cancers. I refer them on then to the general surgeon. So one thing patients need to realize, if you get referred to the surgeon, doesn't mean you're going to necessarily have to have surgery. It just means that we're just going through the proper steps to make sure you're diagnosed properly.
To make sure that they get the right treatment if they do need it. Okay. One thing I'd like to talk about too is also just maybe some resources in the community that are available for cancer patients if by chance you do hear the words you have cancer, and what they can do. And I know that one event that we have are several local support groups that are very beneficial to women in the community, and I know that one is led by you. And so if we could just briefly kind of talk about that. It's called Hopeful Hearts.
Right.
And if you just want to share some information on when you all meet and what you all do during those meetings.
Hopeful Hearts is something we actually started at my church a few years ago. And after I had cancer, I had a lot of support from the community, and I just wanted to give that back to other women. And we meet the second Thursday of each month, and we meet at Lourdes Hospital. Usually it's up on second floor near my office. But it's for all types of cancer, not just breast cancer, because I found that a lot of women end up, they need that, how to live with cancer. Even if you've had cancer 20 years ago, a lot of times there's still that fear, or is your cancer going to come back? What about new cancers? And so we have patients that are actively involved in their treatments, or we have patients that are several years survivor, and they just like that camaraderie, just to know they're doing okay. Right. So we meet the second Thursday of each month.
And you think that's probably beneficial too for them? I think that'd be really helpful. And then also it's great that you're there because you've been through cancer yourself, and to be able to share with the ladies. And sometimes you may get some in that don't really want to talk about it at the beginning, but just to be able to know that there's other women there that have gone through a similar situation, and then maybe later they'll talk about their feelings and things like that.
Well, and with the support groups, whichever support group you choose to go to, a lot of patients have a misconception that it's just a pity party and everything's all sad. Most of the time, they have lots of fun in their groups, but it's nice to have someone else that you can talk to and make friends, and then to help you get somebody to navigate the system, because sometimes unfortunately it can be kind of hard to get through the medical system. And so with support groups, a lot of times you'll meet someone that's been through what you've been through, and then they can help you help find out ways that they were able to get through these things. But our group, it's more on positive living after the cancer diagnosis. And like in my case, I'm 8 years out. So we really focus on positives and how your life can be made better after the cancer. And so we I think those groups are very, very helpful.
Okay. And just to give a number for people to call for more information on Hopeful Hearts, the office number to your local office is 538-5700. Right. So if someone wants more information, they can call the office, and they'll be happy to give them that information. Another local support group is Cancer Port, and that is just for breast cancer women. And they meet the second Tuesday of every month at the Women's Health and Wellness Center in the Pavilion at Lourdes. That time is at 6 p.m. as well. And to contact, for more information, they would need to contact Paula Shell. She's a breast cancer survivor, and she helps run that support group meeting. And her number is 442-4434. I think breast cancer support groups, or any kind of support group for cancer, is very important, just because even with you have family and caregivers, but not necessarily they know exactly what you're going through. And so sometimes it's beneficial to have somebody else there to kind of give you support, and it's so great to see somebody that's already gone through it. And we see that all the time, that some women that are newly diagnosed, it's such an inspiration for them to see somebody that's 8 years out, and so that gives them that extra hope. So that's great. One other thing that I'd like to talk about just briefly are some other resources that are available to people in the community if they are facing cancer. Of course, we are the Kentucky Cancer Program, so I'll talk briefly about us, but we are located downtown in Paducah, and we have information available for patients as well. A lot of times, though, it seems that we're always referring patients out to different people as well, whether it be for information, or some people may even call our office that haven't had a screening ever. They've never even heard of where to go to get a mammography done or anything like that. So we may refer them to their physician, or also to the health department, who has a free screening for those that qualify, or a reduced cost screening. And then also some women may be worried about not being able to afford treatment and things like that. And I know that insurances are getting so much better, and you all probably see that so much with covering mammograms and covering the exams there in the office. But if by chance someone doesn't have insurance, they can go to the health department, or and then if they qualify for that program, then they can qualify for state funds. So that's really beneficial for the community to know that. And I know that as doctors, you all are constantly making sure people are aware of that as well. Any other websites that we have? I know that there's another slide that they're going to show up, but we'll talk briefly about some of the national resources that are available. There's the National Cancer Institute, and the website for that is www.cancer.gov. Susan G. Komen, which is becoming bigger and bigger, is www.komen.org. Of course, the American Cancer Society, and they do have a local office here in Paducah. It's www.cancer.org. And then also, if you just want to pick up the phone and call someone and have somebody else on the line to talk to you about cancer, we can have you call the Cancer Information Service at 1-800-4CANCER. I don't know if you experienced that at all whenever you were going through cancer, if you ever picked up the phone just to call one of those 800 numbers to see if anybody was there or not. I've called the 800 number just to see, just out of curiosity to see what's on that other end of the line. And there is somebody there that will answer the phone and give you information. And that would probably be one of the best things that you could experience while you're going through what you're experiencing. And even family members can call. So that's an added support.
And I think that's an important point as far as with family members. A lot of times the cancer survivor tends to be surrounded with a lot of support group most of the time, but sometimes husbands or family or children can be affected, and with support groups, a lot of times, the family member can even come to support groups, or just to communicate, and then the group leaders can help maybe set them up with another co-supporter or co-survivor is a term that I'd never heard before. I heard this week, and I thought that was really nice. But the co-survivor, so the support person that helped them get through the cancer, because a lot of times the patient is surrounded by lots of help, but then sometimes the family member kind of feels a little left out, and they're scared, and so it's really important to recognize that those family members, they may not be expressing it the proper way. Sometimes they don't know how to be a co-survivor, and that's something that support groups can help advise them on who to talk to. And a lot of times we're dealing with men who may express their emotions a little differently than women, and that's something that's really important, I think, too, is to get them help, because a lot of times they didn't ask for that diagnosis the same as the patient didn't, and a lot of times the coping mechanisms aren't there as well, and that's a big test on a relationship.
That's definitely a good point to add there. Well, I've enjoyed having both of you all today on the show. Thank you so much for coming over and talking to us about breast cancer. And we just want to make everybody aware that October is Breast Cancer Awareness Month. There is the National Mammography Day, and we just want to make sure that every woman that needs to be screened does get their screening, just because we do want the early detection if by chance there is something there. For more information or any more information about this program today, please call our office at 442-1310. And also, if anybody's interested in ever hosting an educational program, the Kentucky Cancer Program does have Just Us Girls Tea Parties, and we do education where we'll go through and show different size of lumps that a woman may find in her breast that can be detected by yourself through a self breast exam, all the way up to what would be found into a mammography, which would be a little bit smaller, of course. So if you have any questions, again, our number is 442-1310. Thanks for joining us today.